First, we're going to look at how these cases are formatted, and then we're going to spend most of our time teaching and practicing how to think like a nurse. And so this is really the big difference between the old NCLEX and the new next-gen NCLEX, is that the new NCLEX expects you to know how to think like a nurse, and they test that using their case studies. And so we actually have 50 case studies online that we use to give you guys plenty of practice with. And we're going to be going through this one today, but this is exactly how it's going to be set up in the actual NCLEX, where unlike the old NCLEX, which you probably heard was vague, and that's true for standalones, you have just enough information to answer the question, but that's not real life, right? You guys have been in the hospital and you know that no patient is ever going to have just one disease or one medication on their MAR, right? They've got 10 of each and more problems and needs. And so this next gen format is much more reflective of real practice, and that's why they made the switch, because this is going to test your clinical judgment and critical thinking better. And so just like in real life, you're going to have a patient chart that you can click through. We can review their H&P, our assessment findings, vital signs. This can also unfold over 6 items where you get more information. And so we're going to go through this in practice in a little bit more detail, but this is essentially the format where you've got a 6-question case study, and you might not be familiar with the clinical judgment measurement model, but it's really not so different from the nursing process, which you guys probably have heard of. And I'll talk about the similarities here. So yes, the clinical judgment measurement model, this looks at our ability to recognize cues, or essentially to assess what's most important, because not everything we can give the same amount of attention, right? And then you're going to analyze those cues or diagnose and consider what could it mean, or like what disease processes could this indicate. Then you're going to prioritize those problems and generate solutions to address them, kind of like your care planning. Then you're going to take action or actually implement an intervention to address those priority problems. Then finally, you're going to evaluate the outcomes and consider, did it help? Did my actions help to correct this problem? So these are the 6 steps and the 6 items that a case unfolds through.